In recent years, the BRICS nations, Brazil, Russia, India, China, and South Africa, have expanded their cooperation beyond economic and geopolitical spheres to address one of humanity's most pressing needs, healthcare. With the COVID-19 pandemic exposing vulnerabilities in global health systems and pharmaceutical supply chains, these countries are stepping up efforts to ensure more equitable access to affordable medicines and healthcare solutions, especially for the developing world. By forming the BRICS Healthcare Alliance, these nations are not only aiming to challenge the monopoly of Western pharmaceutical giants, but are also working toward a new era of international health cooperation. For decades, Western pharmaceutical companies, often referred to as Big Pharma, have dominated the global healthcare market. Companies like Pfizer, Johnson & Johnson, and Merck have established strongholds in high-income countries, setting the standards for drug pricing, research funding, and health innovation. However, this concentration of power has often led to high costs for medicines, with many life-saving drugs remaining out of reach for populations in lower-income countries. Western control over pharmaceutical patents and intellectual property rights has further exacerbated the disparity in healthcare access. Even when generic alternatives exist, stringent patent laws have limited the ability of developing countries to produce or import these affordable versions, forcing them to rely on expensive branded medications. This has prompted BRICS nations to explore more affordable and accessible healthcare solutions for themselves and other developing economies. The BRICS countries have long been advocates of more equitable global health systems. In 2011, they took their first steps toward collective healthcare reform by establishing a working group focused on health issues affecting the Global South. Through this initiative, the BRICS countries began exploring joint research projects, sharing healthcare data, and coordinating disease prevention efforts. The COVID-19 pandemic further accelerated these efforts. When Western countries monopolized vaccine supplies, BRICS nations, especially India and China, took the lead in developing and distributing affordable vaccines to low-income nations. India's Serum Institute became one of the largest producers of COVID-19 vaccines, and China's Sinopharm and Sinovac were instrumental in distributing doses across Africa, Latin America, and Asia. These initial actions highlighted the potential of a BRICS healthcare alliance to act as a counterbalance to the West's control over essential medicines and vaccines. In response to the success of their COVID-19 vaccine initiatives, the BRICS nations formalized their healthcare alliance, aiming to reduce dependency on Western pharmaceutical companies and improve healthcare accessibility in the Global South. This alliance prioritizes collaboration in pharmaceutical research, development, and production. The BRICS Healthcare Alliance is working toward establishing a shared pharmaceutical framework, which includes the production of essential medications, vaccines, and health technologies that are affordable and accessible. By pooling their resources and expertise, the BRICS countries aim to develop a supply chain independent of Western influence, promoting self-reliance in healthcare. China and India, which already have advanced pharmaceutical industries, are leading the alliance's manufacturing efforts, while Russia and Brazil contribute their expertise in medical research and biotechnology. South Africa, which has long advocated for fair access to medicines, brings experience in HIV/AIDS treatment and public health initiatives, emphasizing equitable healthcare distribution. One of the primary goals of the BRICS Healthcare Alliance is to break the monopolistic grip that Western pharmaceutical companies have on life-saving drugs. The alliance has outlined specific strategies to challenge Big Pharma's control, including generic drug production. India, known as the pharmacy of the world, has a long history of producing generic medicines at a fraction of the cost of branded drugs. Through the BRICS Alliance, India plans to increase the production of generics for high-demand medications, especially for diseases like diabetes, cancer, and heart conditions. Affordable vaccines and treatments. Following the success of the COVID-19 vaccine distribution, BRICS is focusing on creating affordable vaccines for other diseases, such as tuberculosis, malaria, and hepatitis. The alliance aims to establish a fund to support vaccine production and distribution in lower-income countries, reducing dependency on Western suppliers. Joint research and development. The BRICS countries are investing in joint research initiatives, focusing on neglected diseases that affect the developing world, such as dengue fever, leishmaniasis, and chikungunya. By prioritizing diseases that Western pharma companies have often overlooked, the alliance aims to address healthcare issues that disproportionately impact lower-income nations. Intellectual property reform. BRICS is advocating for intellectual property reform in global health policies, pushing for more flexible patent laws that would allow countries to produce affordable generics without violating international regulations. This move is critical for reducing drug prices and ensuring broader access to essential medicines. These strategies have put Western pharmaceutical companies on high alert, as they risk losing their monopoly over developing markets where BRICS aims to establish affordable alternatives. The BRICS Healthcare Alliance represents a shift toward a more cooperative, multipolar approach to global health. Unlike the profit-driven model of Western pharmaceutical companies, the BRICS Alliance prioritizes accessibility and affordability, particularly for underserved populations in the Global South. This alliance also offers a platform for sharing healthcare expertise and resources across developing nations. For example, India and South Africa are collaborating on producing affordable diagnostic tools, while Brazil and Russia are leading research on disease prevention methods suitable for tropical climates. By building healthcare infrastructure tailored to the needs of developing nations, the BRICS Healthcare Alliance is fostering a more resilient global health system. Furthermore, the alliance's focus on non-communicable diseases, such as heart disease, diabetes, and cancer, aligns with the growing health challenges in emerging economies. With a shared commitment to addressing these issues, BRICS is paving the way for a global health agenda that prioritizes the needs of populations who have historically been overlooked by Western healthcare policies. As the BRICS Healthcare Alliance continues to grow, its impact on the global pharmaceutical industry is becoming increasingly evident. The alliance's initiatives to produce affordable generics and challenge Big Pharma's intellectual property rights have already led to a shift in how Western companies approach developing markets. Some Western pharma companies are reducing prices for their products in emerging markets, anticipating competition from BRICS-backed generics. Moreover, the BRICS alliance has strengthened ties with the Global South, which has long felt marginalized by Western-dominated health systems. By offering affordable healthcare solutions, BRICS has gained the trust of many countries in Africa, Asia, and Latin America, who view the alliance as a more reliable partner than Western companies driven by profit. However, this shift also presents challenges. Critics argue that BRICS-backed pharmaceuticals may face regulatory hurdles in Western markets, and there are concerns about the quality and efficacy of medicines produced under less stringent regulatory environments. Nonetheless, the BRICS nations are investing in quality control and regulatory standards to address these concerns, aiming to build trust in their healthcare products globally. In conclusion, the BRICS Healthcare Alliance marks a new chapter in global health, one that challenges the dominance of Western pharmaceutical companies and aims to build a more equitable healthcare system for developing nations. By focusing on affordable medicines, generic drug production, and collaborative research, the BRICS nations are paving the way for a multipolar health system where accessibility and affordability take precedence over profit. This alliance represents hope for millions who have struggled to access life-saving medications due to prohibitive costs. As the BRICS Healthcare Alliance continues to grow, it is poised to reshape the pharmaceutical landscape and promote a global health agenda that truly serves all. What do you think? Will BRICS's healthcare initiatives successfully dismantle Big Pharma's monopoly, or will Western companies adapt to retain their influence? Let us know your thoughts in the comments below. And if you enjoyed this analysis, don't forget to like, subscribe, and stay tuned for more insights on the shifting global power dynamics in healthcare.